Good afternoon, everybody. I am John Novak. This is the Washoe County District Board of Health. It's our meeting for the month of February. I want to welcome you all here. We've got a pretty decent agenda today to keep going through. So, Madam Secretary, would you call the roll, please?
Dr. Novak?
Here.
Mike Brown? Here. Oscar Delgado is absent. Christopher Dare?
Here.
Rika Danko?
Here.
Marsha Burkbigler?
Here.
Tom Young?
Here.
We have a quorum.
Thank you very much. We'll do the Pledge of Allegiance now. Mr. Young, would you like to start us off?
Absolutely. I pledge allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. Okay, first item up, we have Mr. Pitkin, you have public comment?
Good afternoon. My name is Michael Pitkin. Housing is healthcare. As a man living with HIV, I know the importance that housing has on my health. I have experience in programs like United Way's HomeForGoodLA.com. In this example here, which I don't know if we can get it on the screen for you to look at, housing is a growing, complex system here in Reno. Also here in Reno, there has been an explosion of anti-opioid use programs like HealthierNevada.org, RallyNevada.org, GSAT UNR, and Washoe County's CBCs. In my own Reno experience, that suggests that there are 80 to 90% of all therapists and psychiatrists here are engaged in drug rehabilitation prevention via surveillance programs. When the main psychotherapy program focus is surveillance, then everything the patient does becomes an addiction. When the program is more important than the patient, this, in my opinion, is not a trustful nor healthy provider-patient working relationship. Community-wide forced entrapment is not the answer. In the second housing authority example, the federal mandates apply here in Reno as well. Anyone who self-admits to drug abuse, methamphetamine, registered sex offender, alcohol abuse, and many others are denied housing from 1 year to 5 years to lifetime. HIPAA is not a guarantee against violation. My question, do ex-convicts, drug addicts, the undesirables have human and civil rights? If yes, then please look at changing these codes. If you treat people like animals, then you force them to live along the river like Les Miserables. If you believe in the power of redemption, then this would be a hand up, not a handout. Stability and consistency is key. Thank you.
Thank you, sir. Okay, moving on. Item number 4 is, does anybody have any changes, corrections to the agenda for today? Hearing none. Take a motion.
Move to approve.
Second. Okay. Mr. Dare, seconded by Chief Brown. All in favor?
Aye.
Opposed? Carries unanimously. Very good. Okay, Mr. Health Officer. You get the good parts.
Yeah, so I get to have some fun. So next we have recognitions, and that was perfect timing by Ms. Jackie Scheides, who's the first person we'll recognize. If you could remain standing for a moment. Jackie has 15 years of service in community and clinical health services in our WIC program. So I appreciate you being here, and obviously she's gotten her timing down perfectly in those 15 years. So congratulations, and also congratulations to Brittany Dayton. Ms. Dayton, if you could stand up. We're celebrating Brittany's 5 years of service with the health district, so Congratulations, thank you very much. And please stick around for pictures later. And then Latricia Lord with Environmental Health Services, and she's in, oh, that's right, we've got the hazard analysis and critical control points training happening. I was close, I missed an A in there somewhere. Happening today for those staff. And then we've got a new hire, and Prinu Skari, if you could please stand up, and I'd like to ask Mr. Cutts to provide us with an introduction.
Good afternoon, Mr. Chair, members of the Board of Health. Steve Cutts for the record. I'm happy to introduce Prinu Skaria. Prinu has been passionate about public health since medical school and working as an internist in India. After exploring a few options in the medical field, she decided to pursue her passion for public health. She holds a master's degree in public health from Purdue Global University. Tobacco was one of her topics of research during her master's program, and her work with smoke-free housing and our chronic disease program is a great fit for her, as she gets to put her research knowledge on tobacco into practice and be part of the mission to prevent smoking in workplaces. So with that, I'd like to welcome Prinu to the Washoe County Health District.
Good. Thank you.
Thank you.
Okay.
All right, and then we also have some Shining Star recognitions today. Rebecca Gonzalez, who I believe is over at our, is she?
She is off on the board.
Oh, she is off today. So Rebecca has 3 Shining Stars, and the board will remember these are for nominations that they receive for their excellent customer service or other great performance on the job. Latricia Lord also 3 Shining Stars, so she's really missing out being in that training today. And Lorena Solario, if you could stand to be recognized, congratulations. Lorena has 10 Shining Star awards, so congratulations for that. And then lastly, I don't know if Mr. Serpa is here or not, so I will go ahead and make the presentation of his plaque now, and then maybe we can redo this. Let us know if he shows up, Ms. Albee. But Mr. Serpa has been a loyal member of our Air Pollution Control Hearing Board, and so these are representatives from our community that volunteer their time to work on that hearing board, to hear appeals of the enforcement actions and make recommendations to the board on that, to provide waivers as necessary if there are special conditions in the regulations, those types of things. So I wanted to congratulate Mr. Serpa for his service from February of 1996 to this February of 2019. So we have a nice plaque to recognize him for his 23 years of service to the Health District. So.
Good deal.
Thank you very
Should
much.
we
to
gotta
Mr.
meet for
Serpa.
pictures, please?
Let's meet for pictures.
Boy, you just made it. You're about ready to sell the plant pin, too.
That one's 250? Yeah. There we go. And here's your certificate. Oh, yeah, go ahead. More's more important than I do.
Okay, just a little bit tighter, please.
All right, 1, 3, 1, 2, 3, and one more, 1, 2, 3.
Thank you very much.
Stick around, Jack, and get a group shot.
Nice try.
Oh, no, you
rubbing that in right now? Oh, no, you didn't.
So, each together, please. Okay. On three. One, two, three. And one more. One, two, three.
Flash is working up there.
Shining star! No, I'm not a shining
No,
star. Well,
just see.
I only have two. Well, that's still great. You got more than I have. I'll go in for you.
On three. One, two, three. And one more. One, two, three. Thanks. Okay. On three. One, two, three. And one more. One, two, three. Excellent. Thank you very much.
I was just gonna ask, does a raise come along with each one of those stars?
Okay, moving right along, we have the consent agenda. And we got a good number of items on there. Does anybody have anything on the consent agenda that they want to have pulled or discussed separately? Hearing none, do I hear a motion to accept the agenda?
I move we accept the consent agenda.
Thank you, Mr. Young. Second. Commissioner? Okay, all in favor?
Aye.
Aye.
Opposed? Good, thanks. I love doing consent agendas. Moves fast, like here. Okay, next item on here is number 7, Inter-Hospital Coordinating Council Presentation of Accomplishments. Okay, ladies. I went to your meeting last month, and I thought it was spectacular. I learned more stuff in that hour and a half than I've known in quite a while. Of course, that doesn't mean much, but go right ahead.
For the record, my name is Tammy Oliver, and I'm the member-at-large for the IHCC.
Push your button.
I think it's already on.
Okay,
just short.
ju-
How's that? Sound better?
whole lot better, yes, thanks.
Yes. For the record, Tammy Oliver, member-at-large for IHCC.
For the record, Andrea Esp, I'm Public Health Emergency Response Coordinator for Washoe County Health District. So today, we have a presentation for you highlighting what the Inter-Hospital Coordinating Council, also known as IHCC, has accomplished this last year and how we plan to move forward this coming year. I think I have a clicker. There we go. So this slide really represents the overall picture, the partners who participate in IHCC. As you can see, there's really a breadth of different healthcare partners, anywhere from our larger hospitals here, such as Renown, to home health dialysis, lots of extras that we participated in, and really highlights everything that we have accomplished. And it's just a great visual because I don't think people quite understand the breadth at which this group brings together in our community and everything that it accomplishes. So last year was quite a year for us. It was the first time we had completed a resource and gap analysis to develop what we wanted to accomplish in 2018. It is broken down by our different public health or healthcare sectors, also our training exercises, and then plans and documents that we wanted to develop. A few things I wanted to highlight is we expanded specialty plans with mass casualty. We did, for the first time ever, a no-notice evacuation drill, which included evacuation of 324 patients out of Renown, Maine. That was quite an accomplishment for that hospital and our surrounding partners. And we had developed a visitation guidelines. These guidelines here in Washoe County allow all of our healthcare partners to work together. So if we were to have an outbreak of some sort, we as a community have decided how we are going to restrict visitation within our healthcare system. So we have one unified voice and have agreed upon that ahead of time. So we felt very strong about getting all of our healthcare partners to agree upon that visitation guidelines here in our community. But moving forward, so what we're really excited about, or I guess what I'm really excited about, you can see, is that our coalition has accomplished so much. It was developed actually in 1994, but in the last couple years, this group has grown by leaps and bounds, and I think this visual really demonstrates that. Not only have they stepped up to the challenge of what they need to do for accreditation purposes and grant requirements, they have really looked at what do we need to do for our community to make it more resilient? How do we prepare ourselves for the worst case scenario and make sure that we have appropriately planned for every single one of us, our family, our friends, and the visitors that have come to our community. And so we have accomplished what I said, this was like Rattlesnake Mountain for you guys, and we've gotten to that, but we're climbing Mount Rose this year, and we'll explain how we're gonna get there. So here's just it's kind of a grant term, but logic model, it's everything that we do, so all our inputs, it's our partners, our resources that we need to accomplish our long-term goals. We have several activities that are that occur every month. We have certain standing subcommittees. We have routine exercises. One that happens quarterly is our redundant comms, so we make sure we test a variety of different communications systems among our healthcare partners. Our short-term goals this year, it has expanded from last year. If you remember our previous slide, we did not include a section just on clinics and home health and hospice. We've included that this year, so we've broken them out. This was also based on a resource and gap analysis, so we really assessed our healthcare community and identified what we want to work on this coming year. We're not solving all problems. We're not solving the world problems this year, but what we're going to do is we're going to really chip away at some of these larger issues that we really feel strongly in our community, regardless of what the driving force is as far as our federal requirements or accreditation. It's things that this community has identified as some needs. A few things I'd like to point out this year is we are doing an alternate care site exercise, and I'm going to talk more about that. And again, we're doing a no-notice exercise. However, last year we did ours during business hours of an 8 to 5, Monday through Friday. This year, and we're currently in the window period of this, we're doing a no-notice exercise that's going to be outside standard business hours. So outside an 8 to 5, Monday through Friday. The no-notice surge. So last year, we took a stab at this for the very first time. It was a exercise that involved all of our partners that are part of our mutual aid evacuation annex. So that includes our home health, hospice, hospitals, not home health and hospice, sorry. I'm so used to repeating those. All of our inpatient facilities, so long-term care, NAM, so mental health is included in that. And we evacuated, like I said before, 324 patients out of Renown Hospital. Those were fictitious patients, so they were paper patients. I walked in one morning and I handed them a stack and said, here you go. You have 90 minutes to figure out where all these patients are gonna go. Renza was also a great partner in that exercise. They were there with us, and they sat down and they figured out not only where those patients were gonna go, but how we were going to transport them to other facilities within Washoe County. This year, though, we're taking it, I said, another step further. We are evacuating multiple facilities, not just one. They still have 90 minutes to figure out where all those patients are going to go, and it is happening off hours. So like I said, they have a 2-week window right now. We're in that 2-week window. It's February 24th through March 10th. Our partners daily ask me, when is it going to be? Do I need to cancel my plans tonight? And you know, they're really excited for it, and I think it's just really going to improve our resiliency here in our community and our ability to respond if we were to have a true disaster. Last fall, we had drafted an alternate care site plan. This plan is for our healthcare community to be able to set up alternate care sites. So it's caring for patients in a non-healthcare facility. Whether this may be a mobile facility that's constructed on site, whether this is a blow-up facility, ones that you may have seen when we've had hurricanes in the south and you see pictures on the news, these big blow-up tents, or maybe we're using the convention center. It's how as a community we set up these alternate care sites and we run them as a unified force. And we are going to be testing that here in April. The exercise is about 2 weeks long, so it's quite lengthy. From how we activate the plan all the way through setting up, we're training multiple people in our community. We'll have 3 alternate care sites set up at Northern Nevada Medical Center, Renown Regional Medical Center, and St. Mary's Medical Center. And we're going to surge those facilities. They're going to play for about 8 hours that day with patients. We're going to have patients code. We're going to have women go into labor. And they're going to have to figure out how to move those patients around and how to care for them in an alternate care site, and then how to move them if they need to into the main hospital if they were requiring, like, say, surgery, something we couldn't take care of them off-site. So that's something that we're really proud of. This county is leading the way nationally for this. There isn't many examples out there, so we're hoping to kind of set the model for the rest of the nation and then grow as other people practice. So we do a lot as a coalition. We have always really focused on grant requirements, and we've done some surveys with our partners on what they think we need to do. But this year it was really important for us to figure out how are we doing? How do our healthcare partners think we're performing for them? I know we get grant funds, and it's really important that they think they're getting the value out of those funds. And so we did a survey this last month. We had 60 responses. 62 of them were our voting members. We have voting and non-voting members. Our voting members are basically our hospitals, EMS, fire, and then public health and emergency management. 65% of those were made up of healthcare facilities, as you can see listed there. So we had a good representation of those who participate in our coalition. Overall, they were very satisfied with this, with the coalition and their interaction with us. So we took that as a positive. Again, we asked how they felt our trainings were going for them. I provided some examples. Again, majority of them were very satisfied or satisfied with how we were performing for them. We asked how satisfied they are with their exercises we facilitate for them. So a lot of these exercises also meet some accreditation requirements for them. And so we want to make sure we're meeting their needs. We had the majority were very satisfied or satisfied. We had one dissatisfied. And that request from that dissatisfied individual was that we include more ham operations. So it's another means of communicating, so ham radio operations in our exercises. So we do take all the feedback seriously, and we're going to figure out how to include that in future exercises. Some of the comments I wanted to share with you guys, you can read them for yourself on this board, but I think these comments really demonstrate the value of this coalition and what it does for the community here in Washoe County. And I don't think we can really give enough thanks to those who have volunteered their time to be here, to be in those meetings, to figure out what's best for the community and make sure it happens, even though they're doing it because it's the right thing to do. This coalition, we say it's the meeting you don't have to come to, it's the meeting you want to come to. It's a very fun meeting, and so we just like to highlight that for you today. And then this is a group photo of us in our matching shirts.
Anybody have any questions, comments?
I have a comment.
Go right ahead.
I just want to say thank you. One of the things that whenever we have an emergency that we get to watch come together at all, I'm always amazed at watching our region come together so well, actually. And this is how you do it, though. You prepare and you make plans. And so the more we can move down that road and make sure that our hospitals and everybody are together on that are key. I think the only question I do have, how does this translate to, making sure, like, so the cities know what you're doing and the jurisdictions? So you guys are all working together with each other. Does this also include some of our city people? So we're aware?
Emergency managers from the different jurisdictions are invited to participate, and they often do come to our meetings. And so we do try to pass that information back through those representatives. We also participate in LEPSI, and so pass that information through that group as well to share with those individuals. It's an open meeting, so anyone's allowed to come anytime. And
So anybody can come to your fund, to the meeting that everyone wants to go to, everyone can come?
Yes, and we
Wow,
offer
we
breakfast
should do
snacks,
that.
so it's a plus.
Thank you. I appreciate it.
Any other comments? I do want to commend you, and to the other board members, if you've never been to this meeting, I really think you need to go by, watch what's happening. It's really kind of an amazing process to see what they've done, where they're going, how well organized this thing really is. And she does have this enthusiasm when she talks at the meeting too. So thank you all very much.
When is the next meeting, sir?
When is the next meeting?
It is next Friday, March 8th. It is at 8:15, and it's going to be at Northern Nevada Medical Center.
Do you have a schedule at all that we could, because I can't make that one, but I would like to get on my schedule. I'd like to come myself.
Yes,
But
we can make sure that you get the information.
thank you.
Yeah, and if you'll get that to Laura, she can send it all out for us. Thank you very much. Okay. I think we are ready to have a special presentation. This is going to be on Special Supplemental Nutrition Program for Women, Infants, and Children. It's the WIC program. Go right ahead, Ms. Erin.
Thank you. For the record, my name is Erin Dixon. I'm a public health supervisor here at the Health District. I have the honor of speaking to you today about the Special Supplemental Nutrition Program for Women, Infants, and Children. And now you know why we call it the WIC program for short. Get us through that. First thing I'd like to do is introduce you to our amazing staff. We currently have 10 full-time staff members and 1 intermittent hourly. We have probably the most experienced WIC team here in the state with a combined years experience of 212 years, which is incredibly impressive.
Wow.
And you were able to get your picture taken with Jackie today for serving 15 years. We currently have 3 locations, one here at 9th Street, one at Moana Lane, it's basically across the street from the fire station, and then once a month we travel to Incline Village Hospital and we serve the residents of Incline up at their location. WIC is a federal program. It was started in 1972 as a pilot program in response to growing concern over malnutrition among many poverty-stricken mothers and young children. By 1974, it had been established in approximately 40 states. So there's over 40 years of research on the WIC program and how it's been adapted and the health benefits. One of the things I would like to highlight is $1 spent in WIC has been proven to save $3 in Medicaid. Some of the health benefits of WIC, honestly, this entire presentation could have been given on the health benefits of WIC. But it's just some of the highlights. It decreases the rate of premature deliveries, reduces low birth weight, reduces anemia rates, increase access to regular health care. It also shows to increase the mother's access to prenatal health care, improves diet quality, and even increases immunization rates. So our clinics here had a monthly unduplicated caseload. Our high this past year was 4,476. We are not the only WIC provider in Washoe County. There are 2 other, Community Health Alliance and Intertribal Council of Nevada. And the USDA estimated that over 85,000 children under the age of 5 in Nevada meet the WIC income guidelines, which I will get to. We provide 4 main services. We provide information specific to the client's nutritional needs and situation, which is very important. We encourage breastfeeding and offer support and supplies. We provide the supplemental foods to meet nutritional needs of our clients. It's important to note that we do not meet all the nutritional needs of our clients. It is a supplemental nutrition program. And then we connect clients to other community resources. Who is eligible for WIC? 1, you must live in Nevada. So our neighbors to the west cannot come to our facility, and our residents cannot travel to California. You must either be pregnant, postpartum, breastfeeding, or an infant or child under the age of 5. You must meet the income guidelines. However, you're automatically eligible if you're on Medicaid, SNAP, or TANF. It is also important to note that at this time, immigration status or citizenship is not required to receive WIC services, and participation in WIC should not impact a participant's ability to receive other services or attain citizenship. I did forget to mention that all foster children under the age of 5 are also eligible for WIC. The income guidelines are established by the feds on an annual basis. WIC guidelines are 185% of the federal poverty level. So if you notice that family of 4, annual income of approximately $46,000. If you have 1 income earner in the household, that's approximately $22 an hour of full-time. So most of our clients are working clients, are working. So what does happen at WIC? This is our staff member, Mr. Frank Kalbel, working with one of our, I don't know how the word to describe him, but adorable clients, testing his iron levels. Most clients have 4 WIC visits a year. This includes 2 office visits and 2 opportunities for education, which can be completed online or in person. Some WIC clients with greater needs can meet with our registered dietitians on a monthly basis. Here's another one of our clients getting measured for her height and weight. We do this as a basic indicator of health and nutrition. As previously stated, we test for iron levels. Iron moves oxygen from the lungs to the rest of the body, helps muscles store and use oxygen. So untreated iron deficiency can affect the child's growth. We also then complete a verbal interview that covers all aspects of the child's health, including developmental milestones. So WIC staff offer personalized nutritional consultation, takes into consideration many factors, cultural, dietary needs, all sorts of factors play into that. We do provide breastfeeding support, so our staff receive 35 hours of breastfeeding support training every 5 years in addition to annual updates. We also provide breast pumps and supplies to clients who have a medical need or who will be separated from their children due to work or to school. We provide referrals and support offered on a wide range of topics, not just nutrition. Staff are very aware that food is one component of a healthy life, and caretakers may have trouble focusing on some of their nutrition needs when they have other needs such as housing, a job, or experience violence. Our staff are mandatory reporters. In addition, it is a grant requirement to ask if clients would like to register to vote at every certification appointment and every time they change their address. The team then delivers the forms to the registrar of voters. As it gets closer to the election, staff are taking these forms over daily to meet the registrar of voters requirements. So needless to say, our staff are not only well-versed in child nutrition, but a full range of social issues. We also have the benefit of having a number of on-site assistance programs. We are fortunate and we have 2 registered licensed dietitians on staff that can meet with clients up to monthly to address their additional nutritional needs. Doctors can also go prescribe specialty formulas, and they can get these filled through WIC. WIC will order them, and the client can come to our office and pick them up. At both our Moana and our 9th Street office, we offer a lactation consultant on a weekly basis where the client can come in and get that assistance. Some of those appointments can last up to 2 hours. We are the only WIC program in Northern Nevada to offer the tobacco-free Baby and Me program. This provides a year of monthly counseling and monthly coupons for free diapers for women and their partners that quit smoking while pregnant and remain quit for up to a year. We also offer free Wi-Fi and a client computer if clients want to complete their online education. It's an attempt to reduce any technology barriers. So what foods? These are a variety of the foods that are offered on WIC. Not every client gets all the eligible food items. The food package is tailored to them. For example, a breastfeeding mom will have different nutritional needs than a toddler. Not pictured is tofu and canned beans, and I'm excited to announce that just this month, WIC added certain yogurts, which the clients are very happy about as well. So WIC food shopping. If you are shopping, look for the yellow WIC approved food tags. They're easiest to find in either the milk or the cereal section. Because WIC benefits are issued in quantities, not dollar amounts, it makes it easy for clients to shop. In addition, this WIC Shopper app can be downloaded to their phone, and it shows in real time what food items are remaining and in what quantities. The only items that are calculated in dollar amounts are the fresh fruits and vegetables. The benefit cards is just like a debit card. Benefits are issued on the 1st of the month, and the client does not need to do anything additional for these benefits to appear. Staff take care of that. We are very fortunate that our state office believes in and supports new technology. Just in the past 18 months, the Nevada WISH program is basically our electronic medical records. It has eliminated all of our paper files and streamlined services. We have online information and education, which allows clients to avoid group classes, self-select the topics they are most interested in, and complete them on their own time. Pacify is a phone-based 24 access to a lactation consultant in both English and Spanish. And we are very excited that text messaging is coming this summer. Our clients communicate often in text messaging, and we're excited to be able to offer that for them. The last component of WIC that I'd like to talk to you about is the Farmers Market Nutrition Program. Staff did point out that it did not begin in 2017, it began in 2016, halfway through the summer. However, in 2017, we started partnering with Minton Family Farms, and they offered their farmers market outside of our WIC office here. 2017, they offered it twice. In 2018, they offered it every other week. Our staff developed healthy recipes, and the state provided the $30 coupon to provide produce. 6 recurring farmers markets in Washoe County participated, and that included the one that we had in our parking lot. And staff really, and me particularly, really enjoyed being able to go out and buy my fresh fruits and vegetables there. And the season ran from June to September. So that concludes my presentation. I'm happy to answer any questions that you may have. And a reminder, please ask that you help us spread the word that WIC is here to assist and to help.
Good. Thank you, Ms. Dixon. Any questions? Yes, sir.
I think my only question is how do we make sure that families know about this? I mean, it sounds like, it might seem like everyone knows all the details, but how do we, beyond just us telling people, do you guys do a lot of advertisement? Do we put anything into that, or?
So we did some advertising in this past September. We tried some social media for the first time. We are trying to do a little bit more on our Health District Facebook page as well. When we do our surveys, honestly, 90% of our clients come from word of mouth.
Gotcha.
And so we do a lot of outreach to other agencies and in that manner as well.
It's good stuff. Thank you.
Anything else? Okay, well, thank you very much. Appreciate it. Okay, Ms. Conti.
Good afternoon, members of the board. Kristina Conti for the record. I am providing my quarterly update to you on the EMS Advisory Board meeting that we held on February 7th. I'm available to answer any questions you might have on the staff report. Wanted to just bring a couple things to your attention. The CAD to CAD update, I know that's something that's been on the minds of this board. There was no update provided at the meeting. I don't know if there's any updates between that meeting and now, but I'd invite City of Reno to come up if there have been to provide you with the most current information. The 5-year strategic plan, what you have in front of you includes the current goals of the regional committee that's been working together so that you can see where we're headed for that strategic plan. If there's anything that you would like to see changed or modified, this is a great opportunity in this moment to do that and to connect with me or Brittany Dayton's the one leading that project. And the final thing I believe that Mr. Dick just passed out, what you also have in front of you, we have some concerns with the data submissions that we've been receiving from one of our partner agencies or not receiving. So what you have attached is the memo from Mr. Dick that was requested from the EMS Advisory Board to update you as the District Board of Health and the overseer of that interlocal agreement on that process. And then we received today the response from the City of Reno, which was also requested at the EMS Advisory Board meeting.
Any questions, comments? Go right ahead.
Thank you. If I could elaborate on Ms. Conti's report. When the EMS Advisory Board met at the beginning of February, we were informed that City of Reno Fire had still not provided their response data to the EMS Oversight Board. So we're a year behind in getting that data. It's part of the interlocal agreement that each of the governing bodies agreed to. And basically, the response today refers to the memo that we were provided back in September that said we were going to get the data within 60 days. So we can't really provide the oversight that we need without receiving this data from the City of Reno. I also believe that from Ms. Conti, I've heard that the City of Reno's presented data on their EMS response at several occasions in the last couple of weeks. So I'm confused as why that data isn't available to us. Thanks.
Any comments? I would like to see this put on the agenda for the next couple months until we get this issue resolved, and I think it's time to have some more conversations on living up to the interlocal agreements that we have, because your group can't move forward until we have the right kind of information to do this. And I think it's a very important piece of how we plan and what we do, so.
I appreciate that. That's why we were working with our partners to get through, but we did hit a point where we couldn't do our job anymore, which is why we brought it forward to the EMS Advisory Board.
Well, I appreciate that, and I think we'll make sure that we continue to follow up and stay at a board level on top of this. Thank you very much. Okay, moving on to item number 10. This green is going to fill in for everybody over there, so.
I know I don't look like J.W. Hodge, do I? Good afternoon, Mr. Chairman and members of the board. My name is Cindy Green, and I am the manager of the Education Department and Community Outreach at REMSA, for the record. So with a large national conference happening currently, and then also with legislature in session, both Mr. Dow and Mr. Hodge are unavailable to be here today, and so they apologize for not being able to be here, but they will definitely be here next time, and they owe me today.
Yes, they do.
So you guys have all received a copy of our January compliance report for your review as part of your agenda packet. I am available to answer questions. If I don't have the answer, I will definitely take it back to my leadership team and then get back to you guys as soon as possible.
Does anybody have any questions, comments? It was a pretty thorough report, comes in our packet anyway, so.
I'll make the motion to accept.
Second.
Okay, Chief Brown, Mr. Dare, all in favor?
Aye.
Good. Any against? Very good. Thank you. Moving right along here. Thank you very much.
Yes. I
Now,
also-
part 2.
Yes, part 2. Hold on, I'll step away. Come back. Thank you very much. Again, my name is Cindy Green, for the record. So you also have a January PR report for your review, but I'm going to give you an update on a couple of things that are happening most recently within our organization. So we announced the achievements and addition of several new employees across the organization, which have garnered some media coverage. This includes the appointment of our clinical communications manager as a regional instructor for the International Academy of Emergency Dispatchers. And then also the addition of Deborah Catrati, who is our new clinical nurse educator. Also, I get to tell you about something that's kind of near and dear to my heart. REMSA, our Center for Pre-Hospital Education, recently, in fact on Friday, we just completed a site visit for our reaccreditation of the paramedic program. Within that, it is a rigorous 2-day site visit after I've submitted plenty and more paperwork than I could ever imagine to the accreditation body. They come out and they do a site visit. Within that site visit, they interview our students, they interview our clinical partners, our regional partners. They do a site visit, they look into every single thing, nook, cranny, every plug, every light, everything within our education center. And it's pretty exciting because at the end of it all, they did not come up with any violations or any citations for our paramedic program. This is a big deal because currently, in order to graduate the paramedic program and take national registry, you have to complete a program that is accredited. So we are accredited, and then this site visit, now that they came back with nothing to go forward with, they will ask for reaccreditation for us. And it will be a 5-year accreditation, so that's pretty exciting. Also within that, at the completion, the surveyors found no violations or citations. And then they also commented that, I have to say all these nice things about my people, that they had not had the pleasure of such an easy and well-prepared survey in a very long time. They also highlighted the commitment, passion, and engagement of the entire education department and commended us for such an incredible survey. I'm so glad that this is all over. I thank you for your time. And again, I'm available to answer any questions that you guys have.
Any questions, comments?
No?
Go, sir.
I'd just like to say congratulations on the accreditation.
Thank
It
you.
is a big procedure, a big process, and there's a lot more than she's leading on to, and she carries a big part of it. So, yeah, congratulations on it.
Thank you very much. I appreciate it.
Anything else? Very good. Thank you very much.
Thanks.
Nice job of filling in for him.
Yeah. Thanks.
We prefer you. I'm just kidding.
You can come back.
Okay. Next thing on the agenda is going to talk about the food tasting program and the new permit process we're going through. Mr. Flory.
Thank you, Mr. Chairman and members of the board. My name is Nick Flory, Senior Environmental Health Specialist in the Special Events Program for the Health District. Environmental Health Services is seeking board's approval for continued implementation of our tasting event permitting process. Additional detail regarding the tasting events and permitting criteria are included in your staff report. Between June 2017 and November 2018, Environmental Health conducted a pilot program to evaluate if staff costs were adequately covered under the tasting event permitting method. During the pilot period, staff time was accounted for in 3 phases, which included pre-event planning, operational inspection time, and post-event closure. Data collected over this time period pretty much indicated that staff times were approximately equal to the existing temporary food permitting structure, which was the original intent of the development of this permitting method. EHS staff has reported back that the permitting method was beneficial based on the single point of contact with the event organizer rather than contacting all the event participants individually. And it also reduced the overall amount of paperwork associated with these types of events. Event organizers were also given the opportunity to provide feedback on the permitting method. The feedback was overwhelmingly positive, and that also can be found in your staff report. Overall, it appears that we've found a method that's working for our internal staff as well as the regulated community, and we're seeking board's approval to continue to implement the method until a more permanent fee can be developed and designed in the future. And I'd be happy to answer any questions that you might have.
Go, sir.
No, what, Nick, what issues, I mean, it sounds like this was a good success to get this rolling, and it's about time to now go to the next step. And how close are we to implementing this?
So this method, we are using our existing fee structure. It's an overall larger project to justify and time account for develop of more permanent fees in the future. It's a big undertaking, so this was kind of like a stopgap method to address a problem in this temporary food program. But the long-term solution is going to be an overall evaluation of our fee structure entirely, which is quite an undertaking.
Well, I understand that too, but I think it's important that we keep moving forward too, and it's a great
Correct,
thing,
yeah.
and I think that's making a lot of progress here too.
I guess the
and
short answer is I don't have an answer for you.
I know. I'm cheering to move forward on these things too, so.
Understood.
Good job on that.
Mr. Dick?
So the timeframe that we have for bringing the fees back to the Board of Health to look at whether we feel like there's any adjustments necessary or new fees to add to that structure is during 2020. When we did the last fee revision was 2015, and the direction we had was come back in about 5 years. So next year is when we would have on our timeline to bring back that package for the board to consider.
Yep.
Thanks for the clarification, Mr. Health Officer.
I want to say I appreciate you reaching out and listening and hearing back from our customers. I think that that's real important, that we're working together to come up with plans. I mean, obviously, we have to make decisions sometimes that some of our customers may not like, but at large, if we can all work together, that's always better. So I commend you for that. Thank you.
Thank you.
Mr. Young, have you had any experience with this at all? Under this permitting system?
Yes, I have. I mean, from the individual, permitting, going up and getting a permit for a temporary license is one way. And this is somewhat nicer from our standpoint because you don't have 30 vendors, doing separate permits, and it makes it a lot nicer. The downside that I've seen in the past are that sometimes the person organizing the entire event doesn't have all the answers at the same time too, but overall, the health inspectors are very well trained and come in and do a great job and can work through that, and it's a lot more streamlined. I'm just happy we did the pilot program and excited about going to the next step.
Good, because Mr. Young has quite a extensive background in special events and doing things off premise. So thank you very much. I do appreciate. Do we have a motion to accept this?
Move approval to acceptance of the report.
Okay, second?
Second.
Okay, we have a first and a second on this. All in favor?
Aye.
Opposed? Another unanimous vote. Thank you very much for a lot of hard work. Okay. And we have the presentation for the 2018-20 Community Health Improvement Plan Annual Report.
For the record, my name is Rayana Lavoie, and I'm with the Washoe County Health District. Today, I will be presenting the 2018 Community Health Improvement Plan Annual Report. As I move through my presentation today, I'll often refer to the Community Health Improvement Plan as the CHIP. The 2018 Community Health Improvement Plan covers the Washoe County Health District and our community partners' accomplishments in the first 6 months of CHIP implementation. The focus areas included in the CHIP are housing and homelessness, behavioral health, and physical activity and nutrition. The selection of these 3 focus areas were identified in conjunction with Truckee Meadows Healthy Communities Across Sector Coalition. Each focus area has objectives as well as corresponding strategies and tactics. There are a total of 14 objectives and 31 strategies in the CHIP. Our first focus area, housing and homelessness. 10 strategies were met. Phases 1 through 3 of the Enterprise Affordable Housing Regional Strategy has been completed. In the first phase, stakeholders were convened at the Truckee Meadows Affordable Housing Forum. After the forum, a community profile was developed and includes an inventory of policies, programs, as well as short and long-term strategies to advance affordable housing in Washoe County. The executive team is now working to identify an organization who will implement the regional strategy. The CHIP Housing Committee developed a document to identify opportunities to alternative funding models like utilizing Medicaid waivers or cost savings to provide funding for housing homeless individuals. Several of the housing items included in the CHIP were submitted as BDRs. The Washoe County Health District also deployed a survey to identify existing case managers across government and non-government agencies to identify the barriers that they're currently facing. To address these barriers, the committee developed a case manager survey to be able to communicate a warm handoff document, which was created and distributed across all of the case managers. Last but not least, a youth homeless roadmap was developed and endorsed by the Raw Leadership Council. Included in the roadmap addresses youth homeless strategies, including establishing a 24-hour drop-in center, identifying a data collection tool, and also increasing the amount of supportive, transitional, and workforce housing. Our second focus area, behavioral health, 10 strategies were met. Some of the strategies in the behavioral health section of the CHIP are also mirroring the strategies in the housing section to be able to support those who have a serious mental health illness and who also need housing supports. A behavioral health data profile was developed, and it outlines prevalence data covering substance use and abuse and mental health. The report can be used to provide information about the behavioral health needs in Washoe County. In 2018, the Washoe County Health District also provided $100,000 to support the Signs of Suicide program. The Signs of Suicide program is a nationally recognized evidence-based suicide prevention program for middle and high school age students. The SOS program has been implemented in 4 middle schools, and just under 1,500 students have watched the DVD. Of those students, 300 students were screened after the presentation. While the screening is not diagnostic, it can indicate the presence or absence of symptoms that are consistent or inconsistent with the risk of depression or suicide. Out of the 300 students who watched the DVD, 30% had a positive screen for being a high risk, which were provided with follow-up services at that time. Our last focus area, physical activity and nutrition. 7 strategies were met. The Washoe County Health District and community partners organized a training with the 5210 Let's Go headquarters in Maine to be able to provide a 4-day training for community partners throughout Washoe County. Over the 4-day training, Let's Go partners taught us how to implement 5210 throughout the community in different settings, including youth organizations, businesses, and healthcare organizations. The 5210 Healthy Washoe team also developed implementation plans for workplaces and youth organizations. We partnered with the Reno and Sparks Chamber of Commerce to deploy a community survey, and the community survey is going to assess the community's interest in workplace wellness. And finally, we held 2 family health festivals. We held a family health festival in the North Valleys community out at O'Brien Middle School. At the Family Health Festival, we saw 50 new households. In both of the Family Health Festivals, we saw over 1,000 participants, and 190 of those families were referred to a primary care home who said they did not have a primary care doctor at the time of triage. After every Family Health Festival, the committee continues to get together to be able to refine the process to better connect families to resources that are available in the community. So overall, 27 strategies were met in the first 6 months of CHIP implementation, which is great progress so far. As we look ahead, we'll continue to implement the strategies and tactics outlined in the CHIP, and we'll continue to meet with our committees quarterly to be able to report on our progress. Again, the 2018 CHIP Annual Report is a product of 6 months of collaboration between the Washoe County Health District and over 55 community partners dedicated to making Washoe County a healthier community. We want to thank our community partners for their contributions and expertise, as these accomplishments would not have been possible without them. That concludes my presentation, and at this time, I will take questions or comments if you have any.
Yes, ma'am.
It concerns me somewhat that 30% of the students who were basically surveyed and talked to would be, depressed or close enough to be depressed that you would think they'd need further service. And I wonder, how are we addressing that? Is there a way to address that in this community? That seems like an awfully large number of students who aren't getting something that they need.
Go ahead.
Well, I don't think that there's an easy answer to that question. I can tell you that we did provide funding to continue the Signs of Suicide program this year, or they wouldn't even be getting that screening if we hadn't stepped up with the funding to do that. There is some legislation this session that would beef up the approach that school districts take to provide more education around signs of suicide and screening. But in reality, I think at that point, we're really looking for symptoms and providing treatment for it. There's a lot of data that shows the impact that adverse childhood experiences have. And we've got some local data that shows the correlation between that and other bullying and behavior situations that those children experience. So that's some of the background I've got, but I don't have a silver bullet for you.
Well, I know there's never an easy answer to any of these kinds of things, but it seems in the greater scheme of what we do and what we spend our funds on, certainly spending our funds on projects and programs that will help us recognize and then help those children seems an appropriate and very important thing for us to be doing. So I hope as we look at new budgets and go into further budgets, we'll really consider that this is something we need to do more of rather than less of.
Very good, thank you. Yes, sir.
Two quick things. One, just on that, I'm going to use my family word again. I like to bring this up, but I do believe our investment in family is probably our number one. I would just like to put out there, when we invest in families, I do believe we start seeing some change in that because they are their best advocate. I know there are some parents that struggle and maybe aren't, but that's not the norm. The norm is our families. I do want to, for a moment, talk about homeless and the youth and what you guys pointed out. And mainly, I just want to encourage them to possibly, whoever that committee is in, consider coming down to our CHAB meeting on April 1st. It was going to be on Monday, March 4th, but because of some studies that we want continued, we bumped the meeting to April 1. What we're doing in that meeting, and the reason I think it's important, is we're laying out as a region with people from Washoe County, Sparks, and Reno together, a plan that we will all work together. And we're asking everybody to help us put that plan together, but we really want to connect the dots. We don't want people off doing this or just that. And you've probably seen that in your studies. There's a lot of silo, we call them, of people doing things, and the bridges aren't always happening. So we want to help fix that. But I think what you're doing is a help to fix that already, but we need you probably at that table at least talking. So I just want to encourage you. I don't know if you plan to be that. I know I've talked to Kevin Dick quite a bit about some of these conversations, but I just want to make sure it's going to the people who are on the ground because it's going to be all of us working together or we won't see a benefit, I think, out of all our time. So that's my opinion, but hopefully you can come.
Thank you. Any other questions? Okay, great.
Any other comments, questions?
Just one final thing. I would just say Christopher's absolutely right on. The CHAB committee is, its number one goal is to bring together all of these different groups that are providing a service to those who are less privileged than some of the rest of us in this community. And so I agree. That's absolutely one area, one committee that any group who's working with homeless, with workforce housing, with children who are living in a poverty situation or whatever, they need to be involved with CHAB. And so the more we can get that out, and Christopher's doing a great job as our chair, so we really, I think we've got a good plan in place. I think it's going to be great.
And maybe Katrina can follow up because she's leading our that work group area on the CHIP.
Absolutely. So I'm Katrina Peters, Director of Programs and Projects for the record. I wanted to come back to
Time
your...
out. We need to accept the report.
Oh, this is on this one, on this item.
No, but we also have one on hers too. We need to accept the report.
This is on Rayanna's item, responding to Christopher.
Oh, I'm sorry. I'm sorry. Well, you're the next person on the agenda anyway. I'm sorry.
Yeah, so I'm Katrina Peters, Director of Programs and Projects for the record, and I wanted to come back to the question about CHAB. And I did want to be sure and let you know that I've been attending those meetings regularly.
I've seen you.
And the Youth Homelessness Group, actually that work started through the Community Health Improvement Plan planning process, recognizing that there were already existing groups doing a lot of work around homelessness. We brought some folks together, got some feedback, and then went out and engaged those existing groups, like, do these strategies look acceptable to you, and got feedback.
Awesome.
And when we were looking at that homelessness issue, and I presented that to Raw, here's what kind of our stakeholders have said, the main feedback I got is that we didn't include youth. So we added that youth item in there, and we've been tracking and working on that. A federal HUD grant had been submitted to try to get some youth homelessness dollars. Unfortunately, we weren't successful, but the desire was to keep tracking on those strategies and keep working in hopes that we'd be able to resubmit when that opened up again and continue to pursue those funds. So we've really heavily engaged folks working on that youth homelessness issue from the Eddie House, Human Services, Catholic Charities, Children's Cabinet, and really I think we're gaining some good momentum. The roadmap we developed, I think, was a good opportunity to get some strategies on paper. So, kind of in the spirit of the CHIP, getting folks together and committing to what we're going to do and how we're going to do it, we saw an opportunity there. And I'd be happy to share that youth homelessness roadmap with the broader group or present that to CHAB if you had a desire.
There will be a time for that for sure, but thank you for sharing that. Actually, now that you say that, I recognize that you've been there, but that's wonderful. Thank you. And I think as we do this together is the answer. And I like to say, we're not going to government our way out of this. It's going to be our community, opening doors for our community to step up and help is the only way that we're really going to see this all come together. So, but thank you.
Sorry, you're next. I need a motion to accept the report.
I move.
Second. First and second, Mr. Dyer, Chief Brown, all in favor?
Aye.
Opposed? Passed unanimous. Now, officially, we will have a semi-annual report on the strategic plan.
Thank you. So again, I'm Katrina Peters, Director of Programs and Projects, and I'm here today to share an update on our progress in implementing our strategic plan, and we're going to look today at the first 6 months of fiscal year 19. So just a quick review. Our vision statement is a healthy community, nice and concise, but I think paints a good picture of where we're trying to go. Our strategic direction is leaders in a unified community making measurable improvements in the health of its people and environment.
Can you talk in the microphone a little closer?
Is that better?
That's a little better.
Okay.
Thank you.
Our mission statement is to protect and enhance the well-being and quality of life for all in Washoe County. And under our mission statement, we have 3 value statements. The first is trustworthiness, and that includes appropriate allocation of resources, spending prudently, and being good stewards of our funds and resources. Our next is professionalism, so that includes conducting ourselves ethically, focusing on education and accountability. And our third is partnership and collaboration. And so that includes things like being flexible, adapting to needs, being accessible to our community partners, and encouraging our staff to be innovative and creative in solutions. Looking at just our first 6 months, so I'm going to talk today about what we achieved from July 1 of 18 through the very end of December. Out of our 143 items in our strategic plan, we have 131 that are either achieved or on target. So we've got a lot to celebrate, and I'm very proud of those accomplishments. To look more specifically at the items in each priority, our first priority is healthy lives, and there we're looking to improve the health of our community by empowering individuals to live healthier lives. Out of the 33 items in priority 1, 32 are on track or achieved. Some of our key highlights there are our CCHS group has continued to do some really great work to expand smoke and vape-free park policies. They've really been working hard on that. We're excited to see that come to fruition. We've also done a lot of great outreach events to provide vaccines and screenings. We also, in that period, were able to get confirmation, and now we have in place an enrollment assistant. So this is a person who's going to be here on location once a week to assist those who may be eligible in applying for Medicaid, SNAP, TANF. Thank you, Steve Cutts, for that assist. That was an acronym I cannot get. We've also had some great success with social media campaigns on sexual health and family planning. Priority 2, and that's around our healthy environment. There we're looking to create a healthier environment that allows people to safely enjoy everything Washoe County has to offer. Out of our 24 items in that priority, 20 were on track or achieved. Some of our key highlights there, our Air Quality Management Division has been working hard to plan the installation of an air quality monitoring station at Libby Booth Elementary, and this is to replace the station that was previously in downtown Reno. The EHS group has been working on waste reduction and recycling efforts, and they've been doing some specific outreach with their permitted facilities. They've also been working to continue implementation of risk-based inspection program standards. Out of their 10 programs, 4 have a risk-based inspection in place, and we're continuing to track on getting all 10 complete. Under priority 3, and that's our local culture of health, we're looking to lead a transformation in our community's awareness, understanding, and appreciation of health, resulting in direct action. Out of our 27 items in priority 3, 25 are on track or achieved. Some of our key highlights there, first looking at the number of weekly unique visitors to our website, we had a peak of 42,000 unique visitors in August, which I think speaks really well to how folks look to us to be that resource for information. We were able to hire our government affairs liaison, Joelle Gutman, and we're very excited to be able to pursue more policy items. We also had several bill draft requests that were submitted. Some of those covered items that were in our community health improvement plan. Also, the Regional Behavioral Health Board submitted a bill draft request, and we're very excited to see those make it through the legislative process. Priority 4 is on impactful partnerships, and we're looking to extend our impact by leveraging partnerships to make meaningful progress on health issues. 16 out of 17 items in Priority 4 were on track or achieved. Some of our key highlights there are EPHP staff or working with child care centers to prevent the spread of communicable diseases that are seen in that environment. As Rihanna mentioned, we also provided funding for that Signs of Suicide program. And the only thing I'll add there is that because the screen is only allowed if we have a parent permission slip, we're actively working with the school district and children's cabinet that actually rolls out the program to identify opportunities to increase the number of parent permission slips that make their way back. So thinking about that 30% of kids that flag as high risk, I think that really speaks to the need for a critical program like this, and we're really just actively working with them to get more permission slips back so we can get more kids screened and get them the help they need. We also had a really successful chip unveiling event in August. We had over 100 community partners come. We were able to share some of the basic details of our community health improvement plan. Also provided a great opportunity to really recognize how important those community partnerships are to something like the chip being successful. So we really had a great time there. We've also had really extensive community partnership in implementing all of those items in our community health improvement plan. And again, really want to thank everyone who's participated and is really working collaboratively to achieve those goals, some of which are pretty lofty. Our priority 5 is on financial stability, and that's looking to enable the health district to make long-term commitments in areas that will positively impact the community's health by growing reliable sources of income. This one's easy, it only has 5. And all 5 of those were on track or achieved. Some of our key highlights there is a bill draft request was submitted, and it's now turned into a bill to increase state funding. As I'm sure all of you know, we're at the bottom of the barrel for public health funding and really looking for an opportunity to improve that. Priority 6 is on organizational capacity, and we're looking to strengthen our workforce and increase operational capacity to support a growing population. 33 out of 36 of those items were on track or achieved. Some of our key highlights, just around 80% of performance reviews across the health district have been completed on time. We're continuing to implement our workforce development plan, and we're excited. We've been able to plan, and we'll be offering this spring 2 new in-person trainings. One will focus on conversation skills and the other on leadership skills. We're excited to be able to provide that. Those topics came from our employee engagement survey findings. So kind of bringing that full circle from surveying our employees, asking them what kind of topics they want training on to be able to provide that training here. And of course, we were able to get our accreditation submission complete and in. With that, I'll take any questions.
Questions? Comments? Yes, sir.
Yes, I think it's incredible that you're tracking this plan so well. Thanks too. It's nice to see the good feedback and that some good achievements there too. It's a long list.
Thank you.
Yes, sir.
I'm sorry to ask it, but you said there's some that we're not going after yet. So as much as you guys have done really great on it, you said there's a few that, I think there's 12 that are not being achieved. And I'm not here to point out what you're not doing, but at the same time.
But you are.
But what are they? I mean,
Yeah.
are they something that we're just not there yet? Maybe sometimes they're the B set of A, and they have to wait for something to get done. And I just want to make sure something's not dropping over here that we need to be paying attention to.
Absolutely. So we utilize some technology to track it, which makes it easy to kind of identify, oh, hey, what's happening here? And I'm happy to provide the details of those 12 items, but to speak kind of in general, they're largely program items that were planned to get off the ground in that time period and just didn't quite make it then. So we'll be continuing to track them. It's not like, oh, you didn't meet it and it drops off. We'll continue to track those and see if we can get those in by the end of our fiscal year.
Yeah, I don't say it to minimize, it just kind of would be nice. That might be good in the report to say these we've not been able to do yet, because then when we're looking, it just answers the question and we see what's going on.
Sure.
Thank you.
And there are comments? Take a motion to accept the report.
I move we accept the report.
Okay,
Second.
second. Okay, Ms. Burstick. We are good. Let's vote. All in favor?
Aye.
Opposed? Good. Thank you very much. Passed again. Okay. Mr. Health Officer. This better be good.
Thank you, Mr. Chair. Well, I'm happy to tell you it is good because, and I want to thank the people that did the work on our fiscal year 2019-2020 budget, which were people from throughout the health district, particularly supervisors and division directors, working with their fiscal compliance officers, and then, of course, our budget guru, Anna Heenan, pulling it all together and putting this together for us. So really, really pleased with the budget that we have. And so I'm going to do the presentation, but I assure you that I'm not the brains behind this. Tapped all the good brains that we've got in the health district. So I'd like to run through for you the health district's recent accomplishments, the health district programs, a summary of our revenues and expenditures, the FY20 sources and uses of funds, that's the budget format that's required by the state, the impact that our budget has on future fund balances, and then our next steps in this process. So some of the accomplishments that we've achieved over the past year, and these are just some highlights, are the work we've done to move forward with our public health accreditation, the updates that we've done with the Community Health Improvement Needs Assessment and Community Health Improvement Plan. Air quality has been active in promoting the Ozone Advance program. Mentioned the financial support we provided for the Signs of Suicide program. Environmental Health Services has expedited plan review times and has a dashboard now on their website showing the plan review times down below a week. The Interhospital Coordinating Council we heard from earlier today, and our work with the local parks and rec departments on banning smoking in those spaces. There's much work, of course, that remains to be done, and so our budget is framed around funding to continue the 22 different programs that we have in the health district as separate budgets that are combined within the health district budget. So you'll see these are the 22 different programs. Those bolded are ones where you see a number of programs that are occurring within those divisions that are included within our budget. To run you through the different budget pieces and FTEs, in my office of the district health officer, our budget is a little over $1.5 million, 7.3 FTEs. Our administrative health services office, 9 FTEs and about $1.25 million. Our air quality management program, just under 20 full-time equivalents there, budget of about $3.5 million. And I wanted to point out also that the way that we do the budget is we fund administrative health services with our local dollars, and we fund the district health office that way as well. So there are indirect costs to air quality management that are captured within funding that we provide to our administrative health services. We also have indirect costs that we pay to the county for the services that they provide for the health district. So while when you look at this number for air quality management, it looks like we're taking in more money for air quality management than we're spending. We're actually, that doesn't cover all the indirect costs that are tied to air quality management that appear budgeted differently. Our community and clinical health services is our largest program with just under 60 FTEs and with expenditures of just under $8 million. Revenues of about $4 million coming in, and that's an area where we've received grant funding, but also have done a much better job with cost recovery through billing over the past few years. Environmental health services, about 43 FTEs, with expenditures of about just under $6.75 million, bringing in a little less than $4.5 million in revenue. primarily from their permits and fee revenue, but they do have a small portion of grant funding that they receive in that division. And then epidemiology and public health preparedness, about 17 and a half FTEs, close to $3 million of budget, just over $2 million in revenue, and that's primarily grant funding that they receive, although we do have the charges for birth and death certificates that are revenue that comes in on that program as well. So the overall budgeted revenues of about $23.5 million are up about $500,000 or about 2.5% over our current adopted budget. And this provides a breakdown for you of the portion that comes from licenses and permits, from grants, from intergovernmental sources, and these include the restricted funds that we get for the air quality program, funding that we get through the dollar per smog certificate fee for Washoe County, and the dollar on the tire sales for each tire sold in Washoe County for the solid waste program. The charges for services and miscellaneous services. The miscellaneous revenue includes $150,000 from the city of Reno that they have been in discussions with us with for quite a while about funding a position on plan review in EHS. And so if that revenue comes through, that's included within the revenue projections. And then the county general fund support that we receive is in there at about $9.5 million. So that's a flat level from FY19 that we're looking at there. It's about just over 40% of our revenue at this point coming through that transfer from the county general fund. I prefer this slide that makes it a little bit more visual to show where our different funding sources come from. And maybe I'll just let people look at that for a moment, see if anybody has any questions at this point before I roll into how we spend it. Okay. So then for our expenditures, total budgeted expenditures of $23,877,500 about dollars. That's up about $450,000 or about 1.9% over the current adopted budget. The salaries and wages and employee benefits comprise about 78% of that funding. And that's sort of the typically high level that you see in government for paying for the personnel that are doing the job. Services and supplies is up $385,000 from the current budget. That includes $500,000 that we've put into the budget for one-time spending. So this past year at the strategic retreat, we brought you an item to provide one-time funding for projects that were approved and that we took to the Board of County Commissioners to get a budget augmentation. So we're building that into the budget again this year to be able to provide support, for instance, for projects that help our youth and behavioral issues and those types of things. The capital budget, about $125,000. That includes the funding for our clinical electronic record system and for air monitoring equipment. So again, we've got a nice pie chart that lays that out, and you can see that the major expenditure being our people, our greatest resource. So let me run through for you the above base requests that we have in the budget. And our above base request here is all to be supported through funding that we have within the health fund. As I mentioned, we've built this budget on a level funding from the county general fund transfer. So that $500,000 for the community health improvement and workforce development projects, The two new positions that we're proposing are for a community health aide in the sexual health program and for a public health nurse in the family planning program. Now, these two positions are actually being requested as above base requests because of work we've been doing in those two programs around how we deliver services better to our clients. And teams that involve an advanced practice registered nurse, an APRN, and a public health nurse and community health aides all working together with a client to provide that service. And in that manner, we're able to provide more clients with care through an APRN involved in that team. And we can also provide for more appointments within a day. The ability to engage the APRN in that care provides some enhancement to the care that the patient's receiving, but it also provides us with an enhancement in what we can cost recover with the billing that we do for those services. So while these are above base requests, there's also going to be some cost recovery enhancement that comes out of this and an improvement in care for clients. The next one is a reclassification of a public health supervisor. We have one supervisor now in the division that's not classified as at the same level as other public health supervisors, so we're taking that to the job evaluation committee to see if we can get that corrected and have equal pay for those supervisor positions. The additional biologicals are to enhance the vaccinations that we're providing. We're proposing to begin providing Shingrix vaccinations for shingles. So this is an above base request to purchase those biologicals. But again, we have a cost recovery aspect to this in billing for the cost of providing those immunizations. We have a one-time funding included in this budget. We've got a number of retirements coming up in FY20. Some people that have been with the health district for quite some time, but Charlene, stop looking at Mr. Cutts. So there's going to be some expenses involved in what they've built up over those many years. The flexibility to move staff from restricted funds to fee-based revenue is also included within the above base request. As we have more services that are being provided with our economic development and whatnot, and we've got that the local dollars coming in through fees and permits. We have other staff that are doing some of that work. That part of their time has been on federal grants, for instance, that have not been increasing in funding levels. So shifting some of that personnel over to the other revenue sources coming through fees and permits. So this slide shows the sources and uses of funds, and this is included within your staff report. And the ending fund balance that we would end up with through our proposed FY 2019-2020 budget would be about just under $6 million and about 25% fund balance that we would have for the health fund with this proposed budget. And when you then look out, because we always try to approach this a little bit conservatively in what does this mean for our future for the health district, looking 3 years out, we're in a very good position in being able to have the health fund grow if we don't have additional expenditures beyond the base that we're proposing here. These future year projections don't include the one-time $500,000 funding that we've proposed this year for those one-time projects, but that's something that certainly we could incorporate in future years if we continue to have a healthy financial position. In looking at in the way we developed our budget, we were somewhat cautious in trying to build a lot more internal staffing for a couple of reasons. One being that that's a long-term investment. The cost comes with those continuing cost of living adjustments, healthcare costs, et cetera. And two, that if we have effective partners in the community that can do the work, we'd like to invest in doing that work together with them versus just bringing on more staff for the health district. There are a couple of unknowns in the budget still at this point, and so those are the cost of living adjustments for our employees. The negotiations are ongoing with our staff, and I believe that we still don't know what our OPEB costs. I've gotten a nod from Anna. Yes, we don't know what the OPEB costs are going to be for the health care for our retirees. So those are items that will probably have an additional cost for us in the budget, but I think we're in a healthy position to be able to adjust for those. So as far as where we're at in the process and what the next steps are, this is my budget presentation for the board, and I'd like your approval of the budget today. But we start early with our budget process for the health district because we've got the kind of the two-step and the two-layer to our budget, where we then also have to meet with the city and county managers as part of our interlocal agreement. And that meeting I have scheduled for tomorrow morning to present the budget to them. Then we also have a budget presentation to the county senior management, and that's been scheduled for next Friday. We'll do that. And then on the 28th of March, I'll provide you at our board meeting, I'll provide you with an update on what we heard from the county managers and how things are looking, because this ultimately needs to go through the county manager's office and be presented to the Board of County Commissioners as part of the county's budget for their approval of that general fund transfer for the health district. And then ultimately this would go for the May Board of County Commissioners meeting for approval and adoption there in their final budget to solidify that transfer. So that's our process. So we recommend that you approve the budget. The total revenues budgeted at $23.5 million, total expenditures at $23.9 million. That includes that $538,000 that's being rebudgeted. That's savings from air quality and solid waste management program. It's 156,000 or 156.3 FTEs, and that gives us that 25% ending fund balance of just under $6 million. And then we'll adjust as necessary to get us through the finish line with how things work out with those COLAs and what happens with the county commissioners. So, happy to take any questions.
Questions?
Yeah.
Comments?
Good job, and it's always nice to know, looking forward, that we seem to be doing well. My only question I have, and it has to do with something we talked about earlier with the CHIP, the CHIP. Are we doing enough in investing in some of these? And I just really, when you sit back and you think about 30% of youth being where they're at, are we doing enough? And it's just a question the whole time you were talking, I couldn't get out of my mind of, we have these finances, and we need to be wise, and it's not always money that's needed as well. We know that. Money doesn't fix things necessarily, but it's a tool that can be used to really help. And I don't know, that would be a question that maybe I would just challenge the whole process. Are we doing enough with what we've been given to, especially the things we've decided are strategy? We can't solve all the world's problems, but we've decided these things are worth our time and our finances. And my only question is, are we doing enough? And I don't know that I have the answer to that, but you're really smart, so I hope no, I'm just kidding. So I'm hoping that maybe we can, that would be my only thing, is we can visit that and say, I don't even know how, but it's, what are we doing to help mitigate some of these things we see? Because to sit back and say, well, we threw 100,000 at it, that's It just doesn't seem enough to me. Just, that's my thought.
Yes, sir. Go right ahead.
No, I go with what our councilman from Sparks says, but I think also partnering with other agencies is a big portion of it, and that's what I see they're doing here, and they have been. And looking at the budget, every year it seems to be more and more solid. From where we were, John and I were talking 4 years ago, where we're at today. And I gotta say, your staff does a great job of putting it together, especially so we can understand a lot of it. We appreciate that. But I see no problems, and I'll make a motion to accept as presented.
Second?
I'll second it, and
Second,
and for purposes of conversation or discussion, I would just say, I think you're doing a great job. I can see some things I'd like to see more money thrown at, but the truth of the matter is, I think we are taking this process one step at a time, and that's one of the reasons why I'm so excited about the CHAB meeting and the way it's going, and that I get to sit on that, and then I also get to sit on this committee, because the work that's going on here is probably the most important work that goes on anywhere in the county. I mean, on any given day of the week, you can argue, and trust me, in this week, when I have all these big meetings, I've heard them all this week, so, but the health and the well-being of our community is so important, and the CHAB committee and this committee in this district are the two groups that I think are really focusing on that, and I appreciate everything you're doing in that respect. And so I think I agree with Christopher. As we look forward into this, hopefully we'll be able to say, wait a minute, we could put another amount of money over here to make this a little better. But there are all kinds of things that we have to deal with, so I just would say thank you for all your work.
Thank you. I do need to have a vote.
That
All
was
in
a
favor?
second?
I seconded.
Yes, she seconded.
Okay.
All in
Aye.
favor?
Aye.
Aye.
Opposed? Good. I just want to throw my 2 cents into this. I think we've done a tremendous job. I think the focus of the health department is mostly on our people. And I mean the whole community, because what we have done in strategic planning over the last couple of years is kind of refocused what we're doing, why we're doing it, and bringing us down to, okay, where's the next step that we can go? And the next step probably is to really look into the youth. We've already started doing some really good work, not finished, but good work on homeless, because that all ties into it. So I think we've done a great job. We're coming on a whole different financial grounds than when Chief Brown and I started 4 years ago. So I think we're doing it. I really want to commend Ms. Heenan for putting together a packet that even I can understand, so. So thank you very much. Let's move on to, let's see, guess what? We're up to legislation.
Yes. Well, and thank you, Mr. Chair. I think this is maybe a good continuation of that discussion of what can we do with some money, because I'm going to be talking about that as well. So we have an extensive spreadsheet. We've been very, very busy with trying to keep up with huge numbers of bills that are now coming out of the session, and with more that we just got today. And so the spreadsheet that you've got is to identify for you the bills that we are tracking, and whether we are supporting, are neutral, or opposed to a bill based on the green for support, yellow for neutral, or red for opposed color code on that column. We don't have all of the evaluation printed out on this page, but you have this spreadsheet electronically, and will be posted with our packet today, where you can click to see the full comment write-up. What I'd like to do is just to run through for you the bills that we've been engaged in so far in the session, and maybe just a few significant things that we see coming up. So if I could do that on AB1, this is a bill that would eliminate the current requirement that we have for publishing a public notice in the newspaper on 3 different occasions before we do any regulation changes and those types of things, to allow us to post information on the website and use media that people currently use to track these kinds of things. And so this is something we've been working with NDEP and the committee on a friendly amendment to that would fix some of their language in there so that we're not subject to the state's requirements that apply to NDEP, but refer to requirements that apply to local governments. So it's kind of an easy fix on that we're confident we'll see moving through. So we're supporting that, and Charlene Albee was involved in that hearing on the 20th of February. AB 76 is the bill that's out of the Southern Nevada Regional Behavioral Health Policy Board, and that was just heard yesterday, and we supported it. Senator Yeager is the member of that committee that was involved in presenting the bill. And it basically provides for staffing for the regional behavioral health policy boards, puts them on recess while the legislature's going on, because each of them's got a senator as part of that board. And it provides for some additional tracking and posting of data by the policy boards. AB 97, this is the bill for public health funding. I had the opportunity to introduce this bill with Assemblyman Sprinkle on the 18th of February. This came out of the Healthcare Committee based on some work that each of the local health authorities was doing in conjunction with the Nevada Public Health Association. Provides for a $15 million appropriation for public health, provides for that funding to be distributed based on population to health districts, and for those funds to be used to support the community health needs assessments and the priorities that we identified from the community health needs assessments. So that distribution to Washoe County would be a little over $2.3 million based on my calculations. And that would be some real money that we could put toward investments and priorities that we identify from our community health improvement plan.
Did they say where that money comes from?
Now, that's a darn good question. And that's what I said was a gorilla in the room when I did my testimony, is that it's not in the governor's budget. The Department of Health and Human Services had requested a budget enhancement to support that, but it wasn't provided. There is going to be legislation introduced that will address e-cigarettes, and so we're hopeful that legislation will move forward that appropriately incorporates e-cigarettes within the existing tax statute for other tobacco products. And we believe that if that is a bill that moves forward, that provides a revenue source that could support this funding and support tobacco prevention funding. And so we're working along those lines to see if that's a way to pull it together. I think this is a huge step forward, though, even if we don't end up with money this session, to have a bill introduced and so far broadly supported by the committee to continue to work into the future for trying to get funding. I'll tell you, when I did my introduction remarks, I compared our 50th in the nation funding for public health to what we invest in K through 12 education. And so, because I think people are just numb to hearing that we're at the bottom of the good list, because we're at the bottom of so many of them. When you compare our investment in public health, which is, the national average is $36. In Nevada, we invest about $6.70 per capita. If you compare that to what we invest in education, it's $8,000 and some dollars per student in education, and the national average is $11,000 or something. But what we invest in education is 74% of the national average. what we invest in public health is less than 19% of the national average. So if you were to bring us up to the same poor position that we are in K through 12 education, we'd be investing about $26 per person in public health, $20 more than we are now. So, of course, education's important and that they're
So is
looking
public
for
health.
funding for it, but we're in a lot worse shape in public health.
Might even help some of the schooling.
Yeah,
Yeah.
better attendance, healthier kids, learn better.
You know, and we wonder why all of our stats are at the bottom of everything.
But I think for that low expenditure, this group does an awfully good job here. I don't know how they do it.
We don't either yet.
I agree. I agree. We're best value. So then, and we're proposing a few amendments to that. One is a fix because the language right now doesn't include Carson City Health and Human Services for getting at distribution. So we've got a friendly amendment. The Assemblyman Sprinkle is willing to work with us on that. And we're also proposing that instead of all of the money reverting back to the general fund if it's unspent after the biennium, that there be some accumulation that occur in the account for public health improvement that this establishes so that there would be funding available for a public health emergency. So not that money would accumulate there forever and become a huge pile, but we have some threshold, maybe $5 million of unspent funds that could accumulate there. So we've got a reserve for a public health emergency that could be tapped. AB 123 is the immunization bill. And this would provide for parents submitting on an annual basis their medical or religious exemptions from vaccinations to the schools. So instead of it being a one-time piece of paperwork, it would be an annual piece of paperwork, and it also requires the schools to provide de-identified information on the vaccination rates, but also to maintain this information so if we have an outbreak, we can quickly identify which children are the unvaccinated children. Steve Cutts provided testimony in support of this on the 19th. There was a huge anti-vax contingent there. In fact, it's a national focus now. They got people flying in from around the country to attempt to misinform the legislature. So we think that this is a positive step, and particularly in the backdrop of the Clark County measles outbreak. And I haven't looked at a number yet this week, but it was like 61 cases last week. It's just a huge multi-million-dollar cost just for the public health response to an outbreak like that, let alone the impact on the children and other people infected. On the Senate side, we've got SB 37, which was a bill from the Marriage and Family Therapists Board that would basically make the licensing process a little easier, allow the counselors to provide additional care. In Nevada, we are the only state in the nation that doesn't allow these counselors to provide counseling for psychiatric disorder or psychotic disorders. So anybody that's practicing anywhere in the country has a disincentive to move to Nevada and have a big piece of their practice lopped off at the same time that we have a shortage of providers to provide care for these people. And so we're hopeful that this will move forward, and it was largely supported there at that committee meeting. And Joel Gutman provided testimony in support for that. SB 42 is a bill that basically eliminates obsolete provisions for alternative fuels that are in current statute. And what we found is this was originally intended to drive some of the alternative fuels programs and fueling, but we've got such limited access to facilities that will actually dispense alternative fuels that we are increasing emissions by driving farther to get alternative fuel for anybody who's using those vehicles. So we're getting rid of this, and I think it's antiquated. I think everybody understands that we really need to be moving toward electric vehicles for our vehicles of the future. So Charlene Albee was there, testified to support this, and was largely supported by that group. Expect to see that move forward. SB 159 is the bill on sunscreen. Sunscreen is considered an over-the-counter medication, and so children can't take sunscreen to school to use it without having to go to the school nurse to have it applied. So this one fixes that and provides for allowing kids to wear sun hats no matter what the school dress code is and those kinds of things to improve sun protection. And Joel Gutman provided testimony in support of that. There's a bill that the text came out today that we're quite concerned about. It's AB 231, and this is on the smog check program. So we don't have comments on this one in yet, but our understanding of the bill is that it will exempt all vehicles that were manufactured before 1996 from smog check requirements. And it's apparently driven by a company that sells tablets that can be used for onboard diagnostic system smog checks. These older vehicles don't have the onboard diagnostic systems. So I believe that it's close to 10% of our fleet here in Washoe County are those pre-1996 vehicles. And as you know, we're right on the cusp of ozone attainment at 70 parts per billion when the standard's 70 parts per billion. So we don't have any wiggle room really with maintaining our attainment. Clark County is out of attainment, and so this would impact them as well. And we'll see where we end up on this one. We're certainly opposed to how it looks right now. We also anticipate something like $23,000 or so of fiscal impact because we'd lose the smog check money on those vehicles as well. And this is the situation that Councilman Dare brought up at the last meeting, where ideally we really want to get decoupled from our air quality revenue from the state coming in through a smog check program and have it just be a fee that's collected at the same time that people register their vehicles, so that we've got a stable funding source and we're not tied to a particular industry or approach to doing the smog check. The couple of bills that are happening being heard on Monday, AB 85 and AB 47, are both from regional behavioral health policy boards. AB 47 is from the rural policy boards, and it provides for alternative transportation for patients from the rural communities. Right now, people that are having a behavioral health crisis, the worst day of their life, perhaps, have to be taken either by ambulance or by law enforcement to a facility that we've got here in Washoe County. And this bill would provide for them getting some more immediate crisis care and alternative transport that might be in a more caring and less stigmatizing environment for them to get here. It would also provide for case managers so that they get more continuing care when they can be released back to their communities. And I think so that provides a better opportunity for people not just coming here and now staying here because they don't have a care opportunity where they go.
What bill was that?
That one is AB 47.
Thank you.
And then AB 85 is from the Northern Regional Behavioral Health Board, the Carson City and the counties surrounding it. And it basically removes destigmatizing language from the current statute and provides better clarification around the legal 2000 hold requirements that are in statute right now. So we'll be supporting those two bills. And then Chuck Duarte and Dorothy Edwards here with the Washoe Regional Behavioral Health Policy Board are continuing their work on AB 66 on the crisis stabilization centers. That one, the way it was put together based on some limited understanding when we were working on this back in September, carried about a $5 million fiscal note on it. But what they've been working on is developing a set of parameters that develop a sweet spot within Medicaid and Medicare for a short-term psychiatric hospital that would provide for better reimbursement from those programs, would allow EMS providers to collect Medicare for delivering a patient there, and basically try to get rid of the fiscal note and be able to support it through the Medicaid budget. The implications of this approach of using a crisis stabilization center is rapid turnaround times for law enforcement to be able to drop somebody off somewhere on the order of 5 to 10 minutes versus maybe being hung up for hours at the emergency room waiting for that patient to just be boarded there versus getting immediate care. And then, of course, all the Medicaid savings that come from not paying the emergency room rates for those being treated, people being treated there. So we're hopeful we'll get to a good spot. The Assemblyman and Sprinkle has actually have been working cooperatively and delayed the hearing on this to let us let those folks work a little bit more on how to get this all set up. So we'll hopefully see that moving forward here real soon. So those are the ones that I wanted to highlight for you. Thank you for indulging me with going through that. But I'd be happy to take any questions if anybody has them on any of the other bills or any concerns.
Yes, sir.
Kevin, on AB 38, the opiate bill, I think with our, direction when it comes to the franchise with our first responders and others, I think that we ought to watch that closely and potentially suggest some language just because of the process that they currently have in there for ensuring that the report takes place with all of our first responders that respond, who's going to do it. And then, I'll just tell you personally, I look at the misdemeanor side of it, and, misdemeanor if you don't respond within 72 hours, so who's going to get that? Fire, EMS, transport services, who? So if we could watch that one, I think that would be a...
All right.
And then I'd just like to make one comment. Our district health officer actually gave a presentation 2 weeks ago at the beginning of the session, and I was fortunate enough to be in the audience, and did an excellent job representing Washoe County and the entire state. He was actually the presenter for Clark County, Washoe County, and Carson with the presentation. And I gotta say, he did a really great job overview, and it was good. And it was nice to see that our district health officer made that happen. And I think it should go that it was noticed, and we should appreciate it. Thank you.
Thank you very much.
I think we need to have an action for at least accept the report. So do I have a,
So move.
Mr. Dare? Commissioner seconds, all in favor?
Aye.
Opposed? Another good vote. Moving right along here. Staff reports. Ms. Albee.
Good afternoon, Mr. Chair, members of the board. Charlene Albee, our Quality Management Division. I'll start off by apologizing for my voice. It is that time of the year for me. I did want to provide some information on the strategic plan update on priority to addressing the question of the priorities or the initiatives that have not been started. We do have one there, and I was going to provide the example. We had planned to expand our air monitoring network out to Verdi, so the western portion of southern Washoe County. We have had to suspend that while we work on the relocation of the downtown Reno site. So that's an example of the things that we have postponed, but they're definitely not falling off of our radar. An update on the Reno 4 site. The Washoe County School District has given us a project manager. We've had a management team meeting with the engineer and our staff, school district staff. They have a preliminary site plan set up. At the last meeting, we were able to identify the type of fencing. They're working on the location of fencing, making sure that the monitoring site is not going to have any blind spots. So they have line of sight from all of the teachers that are on the playground. So we're looking at the safety of the students at that point. The electrical is now the big issue. So our engineer is Mr. Rod Savini. He's contacting the City of Reno and NV Energy to get the permits in place and see what upgrades we have to do for transformers to get the power there. The plan is to do the construction during the spring break. So the installation of the fence and the installation of the power, either the last week of March or the first week of April. So that's where the relocation of that site is at. And with that, I'm available for any other questions that anybody may have.
Questions, comments? This has turned into a big project.
Anytime you relocate a in-core site that's recognized in the Federal Register, it's a big deal. So
Just, it does have an end, right?
it does have an
Okay,
end. Once we
just
get our
checking.
construction done, I think we're going to be pretty good to get it up and running. So,
Thank you, Ms. Selby. Any
Alrighty.
question? Good.
Thank you.
We're wrong. Mr. Cutts.
I have nothing further to add, but would be happy to answer any questions you may have.
Questions, comments? Okay, I'm liking this. Mr. Westham. Nice report. Any comments? Okay, good. Now, this one will take some explanation. Dr. Todd.
Good afternoon, Randall Todd for the record. I was hoping that I could follow my colleagues and say I have nothing further to report, but I do have a couple of items I wanted to call your attention to. In my written report, under communicable disease, there's an item on outbreak response volunteer training relative to HIPAA, and this came about after our measles problem last year, and we realized that we needed more people to help with those kinds of investigations and that they needed to be HIPAA trained. So we had done that. But sort of springboarding off of that, since that derived from measles and has been mentioned earlier today, there is a measles outbreak going on in Clark County, Washington. And I believe the current count is 65 right now. But there is an MMWR, Morbidity and Mortality Weekly Report article that is coming out, or came out just today. And that talks about the outbreak that we had a case that was a part of last year. It was mostly in California, but we did have one Nevada case. And so that case is mentioned in this MMWR article. And I believe it even mentions one of our staff persons by name who worked on that. And just to give you some idea, because I'm sure that most of you probably don't read the MMWR on a regular basis, but it's a publication that has about 1 million people look at that every week, and that doesn't include some 50,000 downloads and podcasts that are also looked at. So it gets a pretty decent distribution for a public health type of article. The other things I'll mention just briefly, seasonal influenza. We had peaked back in December and went down, and then we've been on this gradual rise, and we have now gotten back up to what our peak was in December. So that's not great news. It's been amazing the number of school-age children that have been developing influenza. So I don't recall that I've ever seen so many schools with outbreaks of influenza as we've seen recently. And then finally, I wanted to mention under public health preparedness, we are getting ready to do what's called a CASPER. Has nothing to do with ghosts, but CASPER is an acronym, stands for Community Assessment for Public Health Emergency Response. And this is going to be in March 12 through 17, and it's already been done in Carson City and Las Vegas, so we'll be the last jurisdiction in the state to conduct one. But this is a CDC methodology where we actually send teams out into the field to do these surveys, and they can be done either before a disaster to help officials prepare for a disaster, and that's what the purpose of our CASPER is going to be. But they can also be done after a disaster to help determine needs that are related to the disaster. So we're looking forward to that, and I would be happy to entertain any questions you might have.
Question? I do have one.
Thank you.
Are we seeing the difference in shift in viruses from the flu? As it's been nationally, we're switching from an N1 to an N3?
It's still predominantly an H1N1 situation here, although we might be starting to see a little bit of H3N2, but it's been predominantly an H1N1.
Good, so our vaccine's
Which
fairly...
is actually good, because the vaccine is a little more effective against that
Right.
strain.
Good. Thank you very much. Okay, Mr. District Health Officer.
All right, thank you very much. I've got just a couple of things I wanted to highlight in my report. Last month, Chief Brown asked to get an update on open burning and our work with the fire districts on that. And there was a meeting that occurred, I believe it was on the 25th of February. And Ms. Alby's got a little more information on that, but I think we're off to a good start with moving this forward.
So for the record, Charlene Albee, while this map is brought up, we did have the meeting with the fire chiefs, and we're able to successfully set up a work group to start looking at the burn code regulations that we have right now. So this map is step one that has come out of that work group. They had their first meeting on Monday. What we're looking at, currently the regulations prohibit any outdoor pile burning from November 1st through the end of February. That's really our inversion season. That's when we have our biggest particulate matter concerns from combustion of wood products. The Know the Code program was set up to regulate the wood combustion in fireplaces, and it was prohibited for open burning because at the time we could not sustain the emissions from both of those activities at the same time. So that's why the regulations were set up the way they are. Now that we have gotten back into attainment for particulate matter, the only area that we really have to look at is our maintenance area, which is the blue area. That's the Truckee Meadows Hydrographic Basin. We are proposing to not change any of those rules. We will still restrict the burning there per the regulation to things like agriculture or ditch water delivery, municipalities, things like that. The second part is what we're proposing to change. So the pink area here up by the lake and the green area up north, you can see a better map there. We're proposing to have those be open burning year-round at the discretion of the fire districts and in cooperation with air quality if we do see some issues that are going on. A lot of that would be if we have smoke impacts from wildfires out of state. We need to start reducing whatever we can. So that would be a collaborative effort, but we would open those up year-round. So the gray area, which is around, it's almost like the donut that goes around there, that's the area that we're looking to change the rules also to allow burning during the Know the Code season, but it would be subject to the Know the Code. So if we have a green burning for people in their fireplaces, if the fire departments want, they could be able to burn. If we go to yellow or red, they would not be allowed to do any open burning. So I think we have the structure in place, so now it's just working out the logistics to write the regulations to reflect those ideas. I can say that we've had a tremendous amount of positive input and feedback and reception from the fire agencies. So I think this is really going to work out well for us. I'm available if you have any questions on those.
Questions, comments?
Thank you.
And my sidekick next to me approves, so we're good.
Got just a couple other things on the land development plan reviews. I just wanted to let the board know that with the Tumwa interlocal agreement in place, the way we are now doing our tentative and final map review is happening in the same manner in which it is in Southern Nevada and through Southern Nevada Health District. And as you may recall, when we set out on this work with the interlocal agreement and the changes, the idea was to get Washoe County consistent with how this plan review is occurring in Clark County. I had a meeting with Mark Foray and Bill Thomas, Mark Foray, General Manager of Tumwa, Mark and Bill Thomas, Assistant City Manager, City of Reno, in which there was dissatisfaction expressed that we were looking at these maps for our final map certification. So I did agree that we would look at that and explore whether there was any additional way that we could streamline that process. But I did want to inform the board that what we are doing is consistent and the same as what's occurring in Southern Nevada and with Southern Nevada Health District at this point. And then I did miss a couple of things I meant to tell you during my legislative update, so I'm going to use my legislative session item here just to bring it back around to a couple of those that have to do with housing and homelessness. So part of our CHIP, there was reference that we had some BDRs and whatnot come through in support of our CHIP objectives. One of those was expansion of the 1915I program. That's the Medicaid reimbursement for wraparound services for tenancy. So for the severely mentally ill, to provide them the services they need to stay housed once we can find housing for them. That was included within the governor's budget. So that's something that is great to see included. And then affordable housing tax credits was another of the items that we wanted to advocate for through the CHIP. And that also is one of the first things the governor announced in his remarks for State of the State. So I just wanted to squeeze those in there, and that's all I have for my report. Be happy to take any questions.
Questions?
I just want to say on the permitting part, I was just even sitting with someone today, just talking a little bit, and some of this could be past history of things we may have fixed, but there seems to still be a conversation out there that Tumwa has their portion, and I get the honor of serving on both boards, so let me just say that out loud. But with that said, with whatever board I'm sitting on, this doesn't matter. It seems that we have, sometimes the plans are not looking the same for people. And so trying to make sure that behind the scene, we're all working together to not make it difficult for those trying to get this job done. I think sometimes we're frustrating our customers because we are not getting it. I know we've talked a lot about it, but the more that I've seen, I think it behooves us to make sure we're relationally figuring out whatever bridges we have to cause back here to make sure we're doing it. And I know eventually some of our ultimate plans of digital stuff might fix all those things, but we're not there, and it's going to take a while to get there. So in the meantime, just making sure we're not creating this, like, this is what we do, we're not changing, this is what you do. Well, all that does is hurt development and hurts everything else we do. Well, that's not the intent of this stuff. So we need to make sure behind the scenes, do what you're supposed to do. I agree. No one's asking you to do anything else. And for Tumwa, that you guys have to figure out how to make sure we're not making these people run around circles to be able to get their plans through or whatever. So I just want to say that. I just met with somebody today, so it was fresh on my mind of it's still out there that's, now again, this particular person could have been something that happened a few months ago and we're fixing that. But do you feel that we're on the same thing where we're not having this, or are we still in that place?
I think that since we're just a few months into the implementation, I suspect that there's still some of those edges that we need to smooth off that may be out there. But I can tell you, I completely agree with you, and that's where I want to get to is how can we make this work the best? And that's why I'm providing you with a status update that right now we have reached the consistency with how Southern Nevada Health District is approaching this. But I want to continue to look as if there's more that we can do that can streamline this process.
Thank you.
Thanks.
The same thing you did this morning. I met with an engineering group, and they were complimenting the health department and how this is working better. So I think it's in the right direction.
Wait, whoa. Say it again. Say it really loud. I like to hear that.
Okay. Any other questions, comments? Good. Moving along. Any new public comments? Okay. WIC board comments. And this comes down, do you have anything you want to have an agenda? Do you want to have a topic you want to comment on? Good. Nice quiet crowd. About time.
We're 14 minutes over our 2-hour mark. No comments.
Okay.
I'm just kidding.
I had
No.
a 12-hour meeting yesterday, so this is...
Oh, ouch.
Yep. The only thing I want to say from my standpoint, you approved me going to the NALBO meeting. It's going to be held with conjunction with NACHO and ASTO and Washington, D.C. in 2 weeks. It has become a really big project that's taking on a even larger role with it. The cooperation now between NACHO, which represents the health officers, the NALBO, which represents the boards, and ASTO, is the tribes and other public health services are really getting together and putting on a really effort. We're going to Congress on that Wednesday. I think the Wednesday's the 12th. I'm already scheduled along with Joe Eisner from the Southern Nevada and Nikki from Carson City. We will be meeting with the 2 senators from Nevada and also Representative Amadei. So we've got a good schedule already, and we're set and ready to go. The amount of information we have been receiving, prep work, time-wise and everything else, to really make this a good effort. But I can see a really good coming together for public health, because if we can pull this off and really form a real cohesive group between the 3, we now represent all of public health, not just one part, which it's been until last August. So I really looking forward to this next meeting. I think it'll be worthwhile for all of us on even, trickle down money from the national level too. So maybe we can get some more for your kids.
Can you help make sure you communicate to me, which I'll be actually meeting with them on the 13th for other things. I'll be in DC the day, well, I'll be there while you're there, but the day after I meet. So it might be nice that I can, hey, remember? So they hear it more
Thank
than
you.
once a little bit, so
Thank
make
you.
sure I know about.
If I've got anything, I'll get that to you. Very good. I will entertain a motion to adjourn. Oh, I guess
So moved.
Okay. And we're good. All in favor?
Aye.
Thank you very much. Not too bad for a lot of work to be done.